Good day to all. My name is Jessamila Duran, and today I will tackle about on how to identify student with hearing impairment. For the overview of hearing impairment, hearing loss often goes undetected, which means many children with hearing loss do not receive early intervention. It is not unusual for a child's hearing loss to be detected as late as 5 or 6 years of age. So, you can identify early signs of hearing loss by noticing a child exhibiting any of the following signs: speaking too loudly or too quietly, using a pitch in speech that is too high and too low, not responding to questions appropriately, frequently requesting that you repeat directions, not replying when called on to answer a question, complaining of earaches or ear pain, pulling on or tugging at ears, frequent ear infections, frequent headaches, or moving closer to you when you are reading books or talking to small groups. Signs and symptoms are different for all children. If you notice a child who exhibits one or more of these signs, it is recommended that the child receive a screening for possible hearing loss. Preschool teachers often see these subtle signs, then a child might have a problem but mistake the symptoms of hearing loss as misbehavior or learning difficulties. If you suspect a problem, there are also checklists you can use that indicate developmental progress. These are simple tools you can use to determine whether you should refer a child to an audiologist. Many of these checklists are available online as a tool for families and teachers alike. Once a child's hearing impairment has been detected, it is important to have a general understanding of what a hearing impairment is and how this impairment will affect the child in the classroom. Professionals often use the term hearing impairment to describe hearing loss. There are 3 types of hearing loss that a child may have: conductive hearing loss, sensorineural hearing loss, and mixed hearing loss. Conductive hearing loss, which is the most common type of hearing loss, usually is treatable through medication or surgery. This type of loss often is a sign of impacted earwax, fluid in the ear, allergies, or infection. Sensorineural loss is not treatable by medications or surgery and indicates that the problem lies within the inner ear or nerve passages to the inner ear. This form of hearing loss usually is permanent. Mixed hearing loss occurs when a child has a combination of sensorineural and conductive loss. There are several assessments available for determining the degree of the child's hearing loss. Most commonly, an audiologist administers an initial audiological assessment. The audiologist is trained to diagnosing, treating, and managing individuals with hearing loss and balance disorders. Typically, a child will receive an audiological assessment upon referral to an audiologist. This assessment will help determine a person's degree of hearing loss. People with hearing impairments may have a partial or complete loss of hearing or being deaf. In addition, a person with hearing impairments can experience a loss in one or both ears. There are 5 degrees and severity of loss: the mild loss, moderate loss, moderately severe loss, and the profound loss. For the mild loss, a person will experience difficulty identifying soft sound such as whispering. For the moderate loss, a person will unable to hear clearly what others are saying during conversation. For the moderately severe loss, the person will unable to clearly hear loud noises such as telephone rings. For the severe loss, a person can only hear very loud noises and sounds such as shouting or vacuum cleaner noise. And lastly, for the profound loss, a person will have difficulty perceiving any sound. It indicates the level of hearing loss, but it is important to remember that audiometric descriptions of hearing loss do not adequately describe how well a student might be able to use his or her residual hearing for learning, especially if amplification is helpful and if the loss does not interfere with hearing human speech. There are identified areas in which a hearing loss can affect children, especially in school. First is, it causes delay in the development of receptive and expressive communication skills or the speech and language skills. Next, the language deficit causes learning problems that result in reduced academic achievement. And lastly, the communication difficulties often lead to social isolation and poor self-esteem. So, all in all, hearing loss can affect children's vocabulary, sentence structure, speaking, academic achievement, and social functioning. It is important to know the type of hearing loss a child in your classroom has, as well as the kind of support he will need to be successful in the inclusive setting. Regardless of the degree of hearing loss, new technological advances make it possible for children with hearing impairments to attend inclusive schools successfully with peers who have no hearing impairments. What teachers need to know about hearing impairments? Teachers often overlook or misidentify children with hearing impairment as having behavioral problems. A child with hearing impairment might often say "what" or "huh?", speak in a loud voice, need people to raise their voices so she or he can hear them, inconsistently respond to verbal directions, or answer questions that are on his cognitive level, not turn his head when his name is called, turn her head to whoever is speaking consistently in an effort to see the speaker's face, listen to music at a very loud volume, have limited use of a verbal language, appear to ignore the speaker, or frequently ask for questions to be repeated. Once identified, it is important to be aware of and report any changes in the child's behavior. To develop an intervention that meets the need of the child requires the implementation of routine audiological exams as well as ongoing speech and language assessment. However, this information will only benefit the child if paired with the observational data you provide. It is important to gather information not only on those child's academic progress, but also on whether or not the child indicates concerns about background noise or his ability to hear classroom discussions. You also can observe the child for answers to common questions such as, how often does the child adjust her hearing aid? Does the child willingly use her hearing aid? Does the child frequently ask others to repeat directions or parts of conversations? Does the child consistently lean one side of his face towards the speaker? Are there particular sounds that the child struggles to say? Does the child cover her ears when she hears very loud sound? These are the questions that are needed in order to record how the child handled his or her impairment. And that would be all. Thank you and God bless. There are several assessments available for determining the degree of the child's hearing loss. Most commonly, an audiologist administers an initial audiological assessment. The audiologist is trained to diagnosing, treating, and managing individuals with hearing loss and balance disorders. Typically, a child will receive an audiological assessment upon referral to an audiologist. This assessment will help determine a person's degree of hearing loss. People with hearing impairments may have a partial or complete loss of hearing or being deaf. In addition, a person with hearing impairments can experience a loss in one or both ears.